Thank you for exploring our series of short videos intended to provide practical information on oral health. These videos were developed with caregivers in mind, whether you're taking care of a loved one at home or you're a professional working in a care facility. These videos provide tips on oral care practices and include information on a range of oral health conditions. Please keep in mind that it takes many years of study to become a dentist. We are sharing some of our knowledge that we have gained in dental school and over our years of caring for patients. Hello, my name is Dr. Sally Cram. I'm a member of the DC Dental Society and the DC Dental Society Foundation. I'd like to talk with you today about medications in older adults and their effects on their oral health. What are some of the most common health issues in older adults? Well, certainly hearing loss. I'm sure many of you know someone who wears hearing aids. Eye issues like cataracts, glaucoma, macular degeneration. Many seniors suffer from chronic pulmonary obstructive disease or pneumonia. Diabetes is one of the leading chronic inflammatory diseases in seniors. Many suffer from depression, incontinence, and certainly cognitive decline becomes an issue as we advance in our age. Balance and mobility can be an issue. People are more at risk for falls. And oral health issues like tooth decay and gum disease are very prevalent. 68% of our seniors have some sort of gum disease. Heart disease, of course, is on the rise with hypertension and our diets. And malnutrition is a concern in seniors, particularly those who may live alone. So you can't help but see on television that we are an aging population, and we're an aging population that takes a lot of medications. What are the top 10 medications being prescribed right now? Metformin for diabetes, azithromycin, which is an antibiotic used to treat pneumonia and some other chronic inflammatory diseases, levothyroxine, that's a thyroid medication for people whose thyroids are not acting as they should. Blood pressure medications such as lisinopril, amlodipine. And then, of course, we have issues with gastric reflux. Prilosec is very commonly prescribed. In one of our earlier presentations, we talked about coronary artery disease and heart attacks. Many people are taking cholesterol drugs like simvastatin. Another common drug for blood pressure is hydrochlorothiazide. And then also, as we get older, it becomes more difficult to have a restful and full night of sleep. So many sleep aids like Ambien are prescribed. We also know that in our older population, many people suffer from depression, so they might be taking a drug like Wellbutrin. What are the 5 major oral side effects of medications? Certainly one of the most predominant ones is dry mouth. We also can see gum enlargement, ulcers and sores in the mouth, oral thrush, which is a fungal infection, and taste changes. I'd like to hone in on each of these major side effects and talk about some of the medications which contribute to them. So let's start with dry mouth. When the mouth is dry, many of the symptoms would include a sore or raw tongue. You might have the individual that you're caring for complain that they don't taste their food properly, or the food does not taste like it normally tastes. They might complain of extreme dryness and discomfort, maybe even difficulty in swallowing. We might notice a bad odor, bad breath coming from their mouth. This could be related to dental decay, cavities, or it could be because they have some form of gum disease. Some infectious diseases may cause dry mouth. And of course, they might have difficulty in speaking, and they might have upper respiratory digestive tract issues. So all of these could be the result of dry mouth and some of the symptoms you could be looking for. Dry mouth is caused by reduced salivary production. Saliva is very important because saliva in our mouth actually has the ability to help control bacteria, kill bacteria, and lubricate the oral tissues, the cheeks, the tongue, the floor of the mouth, the throat. When we lose our saliva and the amount of saliva we're producing, the mouth becomes very acidic. So we don't have that buffering capacity. And as the mouth becomes more acidic, then teeth, which normally get calcium out of our saliva and make them stay hard, teeth don't get this calcium, and the remineralization of the surface of the tooth gets disrupted. So as our mouth becomes more acidic, we are more at risk for getting tooth decay. The acid is produced by bacteria in the mouth that then ferment the sugar in our diet, which causes the acids to eat holes in the teeth. This is tooth decay. Dry mouth leads to increased bacteria, both the bacteria that cause strep mutans, that cause tooth decay, as well as the bacteria that cause gum disease. And as we know from previous presentation, almost 68% of adult seniors have some form of gum disease. Dry mouth can also cause oral thrush, which is a fungal infection. So let's take a look at a slide of what a dry mouth and tooth decay might look like. You might notice that in the person you're caring for, their teeth start to have dark brown or black stains on them that don't come off with brushing. These are actually areas in the enamel of the tooth that have become eroded and non-mineralized. This is a very severe case of untreated tooth decay, where in fact the entire crown of the tooth, what we need to chew and function, is gone. It's decayed right down to the gum line. So what sort of drugs cause dry mouth? Well, there's a large number of them actually. Some of the biggest culprits are blood pressure drugs and heart medications, particularly diuretics, which they're used to decrease the fluid and water in our body to help decrease our blood pressure, but they also decrease our salivary flow. Anticholinergic medications are also used to treat overactive bladder, a common condition in particularly elderly women. And because they have an overactive bladder, many of these meds may cause the dry mouth. Alzheimer's drugs, such as Aricept, Exelon, and Razidine, are commonly known to cause oral dryness. Drugs used to treat anxiety, dementia, and insomnia, all common issues in those over 65, like Restoril, Xanax, Ambien, and even Valium. One of the biggest class of drugs causing dry mouth are the antidepressants, like Wellbutrin and Prozac. Those are also commonly used when patients are depressed, especially if they're socially isolated or sometimes living in a home. Antihistamines and decongestants are also causes for dry mouth. These dry out your nasal passages, but they also dry out the salivary flow in your mouth. And then, of course, last but not least, Parkinson's medications. Many of the Parkinson's medications are also responsible for decreased salivary flow. Let's take a look at another common medication-induced problem: gingival hyperplasia, or in layman's terms, gum swelling. If you look at this slide, you'll notice that the gums are so enlarged that they're almost covering a half or 2/3 of the crown of the tooth. You're barely able to see the teeth beneath the gums. Why is this an issue? Well, as we heard in some of our other presentations, oral hygiene is a very important thing to keep the mouth healthy. And if the gums are growing over the teeth, it's very difficult to brush and floss effectively and remove all the plaque and bacteria that cause gum disease and tooth decay. In fact, in some cases, the gums can enlarge so much that they actually grow over the teeth, and this can even interfere with chewing and proper eating, which we know nutrition and diet is very important in elderly individuals. So what are some of the drugs that cause gum enlargement? Well, again, we have some blood pressure medications. These are very commonly prescribed ones, if you remember from our original top 10 list: amlodipine, diltiazem, nifedipine, verapamil, and of course the biggest one that we see quite often is Norvasc. Some of our patients are transplant patients. They may have had a kidney transplant or a liver transplant. Cyclosporins that are used to keep them from rejecting their new organ, like Neoral, Sandamune, and cyclosporin A, have all been shown to cause some form of gum enlargement. Epilepsy medications and anti-seizure medications like Dilantin and phenytoin have traditionally been known to cause gum enlargement. But what we do know is in all these cases, if the plaque and bacteria are controlled on a regular basis, it makes the risk of developing this gum enlargement a little less. Let's talk about ulcers and sores in the mouth. Why should we be concerned about that? Well, you know, if you get a little ulcer or you bite your cheek, it's very uncomfortable, and it can be very, very painful to speak, to eat, to function normally. So when we have ulcers in the mouth, it could lead to malnutrition. Could be related to herpes infections, but these ulcers typically occur on the tongue and the cheeks. So here's two examples of some common ulcers. On the left, you see ulcers that are occurring on the lips, the corners of the mouth, and even on the skin outside the mouth. This is from a herpes infection. And by the way, if you see this in someone you're caring for, please be careful and wear gloves when helping them with their home care. These little blisters and ulcers are very infectious and can spread the herpes virus to your fingers, other places on the body, anywhere where you might have some broken skin. So it's very important to recognize this and take proper precautions when you're helping these people with their self-care and their oral health. The slide on the right shows an ulcer from chemotherapy. This person was taking methotrexate and, as you can see, developed these very large ulcers under the side of the tongue. Interestingly enough, the person kept complaining of pain and soreness, and people glanced in his mouth and didn't see anything until the tongue was actually retracted and they could see these ulcers on the side of the mouth. So it's really important to ask people to stick their tongue out, get a good light, and take a look in there when someone's complaining of pain or something that doesn't feel right. What medications can cause sores or ulcers in the mouth? Well, one of the biggest ones is cancer chemotherapy drugs like methotrexate. I personally have seen several cases of this in patients I've treated over the years. Osteoporosis drugs, very common in this day and age. Many women over 60 years of age are now taking drugs for osteopenia or osteoporosis. One of the most common ones prescribed is Fosamax, which can cause oral sores or ulcers. Non-steroidal anti-inflammatories. These are over-the-counter things like aspirin, ibuprofen, commonly given to people for arthritis or joint stiffness or headaches. These also have a preponderance for causing sores or ulcers in the mouth. And we also want to be careful about sticking aspirin inside the cheek, which is sometimes a common practice in older people. If they get a little toothache or a problem, they'll stick an aspirin inside the cheek. The aspirin can actually burn the tissue and cause an ulcer. Blood pressure drugs, like beta blockers used for angina and atrial fibrillation. Also drugs used to treat heart attack risk, like metoprolol and atenolol. These can also result in sores or ulcers in the mouth, more commonly in the floor of the mouth or under the tongue. Let's now talk about oral thrush. This is a fungus that's present in the mouth 24/7. We all have it. It's usually at very low levels, and our body's immune system is capable of keeping it under control. Why is oral thrush a concern? When we get oral thrush and the fungus starts growing in our mouth, it makes it difficult to swallow and eat. And the serious part of it is it can actually spread into our esophagus and our lungs if it's not properly treated. A fungal infection in the lungs can be very serious and result in pneumonia. And as we know, pneumonia is one of the common causes of hospitalization and death in people who are in homes or who are elderly. This is a picture of the most common form that occurs at the corners of the mouth. You'll see the corner of the mouth is cracked and red, and the patient will complain that it's sore and uncomfortable. What are some of the symptoms? Well, a red mark in the center of the tongue, difficulty in swallowing, the redness at the corners of the mouth that I just showed in the last slide, difficulty drinking, and again, the cracks at the corner of the mouth. Sometimes the cracks at the corners of the mouth are caused by dryness because they're taking a medication that may cause dry mouth. And as their mouth and lips dry out, the cracks accumulate the fungus. And the fungus, the Candida albicans, is the fungus that makes the oral thrush. What drugs can cause oral thrush? Well, large or prolonged doses of antibiotics like azithromycin. Many times people in facilities, assisted living facilities, or possibly at home, may have pneumonia or issues where they need to take prolonged doses of antibiotics for more than a week. Reduced immunity. Some patients with transplant or cancer treatments like Humira, Enbrel, and Cellcept are some of the common medications that may cause oral thrush. And of course, we have our list of medications that cause dry mouth. The antihistamines, the blood pressure medications, the antidepressants. The list that we saw previously all have a preponderance for causing oral thrush to proliferate. And of course, inhaled corticosteroids for asthma and COPD, Symbicort and Pulmicort. So very important if you have someone you're caring for who uses some sort of inhaler to make sure that they rinse with some water afterwards and clear the oral cavity of some of the excess medication, because the medication may cause dry mouth and then also cause the oral thrush to proliferate. So on the slide, you'll see the case of a person who had cancer and had significant amount of their jawbone and teeth removed and then had chemotherapy. And as a result, they developed oral thrush. Those are the white patchy areas that you'll see on the left side. This was very uncomfortable for the patient. Here's another case, it's a slide I showed you a little earlier, of oral thrush at the corners of the mouth. And both of these cases of oral thrush are easily treated with an antifungal cream. Let's look at taste changes. This is the last category of changes that we can see as a result of medications. Taste changes are very common in older adults, especially those who take multiple medications. Many people will report a salty, metallic, sour, or bitter taste, or the person you're caring for may just simply say, "My food doesn't taste the way it used to taste." And clearly, as we're dealing with older individuals, we need to make sure that their nutrition is adequate. And we need to make sure that they're eating to keep their immune system functioning at top level. So taste changes could be a result of dry mouth that we talked about earlier, or also a fungal infection, like the Candida infection we talked about earlier. This is an example. You'll see the red sort of bald spots on the tongue, and then you'll see the white areas, patchy areas. This is a case of oral thrush, and this definitely affected the person's taste ability. The tongue is made up of a series of little papillae and taste buds that help us taste our food and enjoy the flavors of different foods. When the tongue gets bald and loses some of that area due to the fungal infection or dryness, the taste changes can be pretty common. What drugs can cause taste changes? Well, certainly antihistamines. Antihistamines are used quite commonly for allergies, many over-the-counter ones even, but they're also used many times in assisted living facilities or places where people have dementia to help them sleep. Antibiotics like ampicillin and Levaquin have been shown to cause definite taste changes. Antipsychotics like lithium. Some of these medications are sometimes used to help in dementia patients and Alzheimer's patients to regulate their mood. And diabetes medications like glipizide have been known to cause taste changes. Parkinson's medications like levodopa also can cause changes in taste. So let's review what we've learned from our little presentation today. The key takeaways are this. First of all, older adults tend to take multiple medications, and these medications can have many oral side effects. It's important as a caregiver to recognize the oral signs of possible medication side effects. So it's really important to know what medications the person you're caring for is taking. Most of these oral side effects of medications can be managed by simply changing the medication or treating the problem, the dry mouth, the fungal infection that's related to the medication. I'd like to thank you for listening to our presentation today, and I hope you learned some good tidbits to help you in assisting in taking care of others, either at home or in your facility.